So, Dr. Fernandes, thank you very much for joining us today. Now, we'd written out, we'd asked people to raise any questions that they wanted to ask of you. So I'm going to read the questions out. If you kindly give us an answer, that would be fantastic, and then we'll do a more general Q&A at the end of this session. So the first of these questions in relation to COVID-19: how long do the antibodies last after you've had a vaccination?
Thank you, Paul. Thank you for having me.
Yeah.
Can I just first of all say I've been a GP for 30 years now, so I've actually not only seen the grandparents, but also the parents and grandchildren, and in some cases the great-grandchildren. So in terms of being able to give people advice that keeps them well, that's my job. I also should say that I had COVID as well. It was the first time in 30 years that I was ill. I'd never seen the inside of an ambulance lying on a trolley before.
Correct.
Or listened to lights and sirens as I was taken into hospital. Wasn't a pleasant experience. And for the first time, I was off for 5 weeks, being really ill. Having recovered from that, there's also the after effects called long COVID, and we could talk about that later if you needed to. And I've also had my first COVID vaccine dose. So a number of questions that people will ask is we can answer that from that one experience. So in terms of how long do the vaccines last? So typically, when you have a vaccine, it may be for a long period of time, and in this case, we're talking about at least a year. We don't know whether it's going to be longer, but at least a year is anticipated. Whether it's the same region as the flu jab, we don't know. It's a new virus, it's a new vaccine, and we're learning all the time. But anticipate that at least a year you'll have the immunity.
Okay, lovely. Thanks for that. Second question is, rather than 3 weeks between doses, which was the original suggestion, it's now been extended to 3 months. Is it still as effective?
Yes, absolutely. Although the trials for the Pfizer actually looked at 3 weeks, the efficacy that has been shown from all the data is that after 3 weeks, you do get at least 89 to 90% efficacy for the Pfizer vaccine, and about 75% for the Oxford AstraZeneca vaccine. So it does give you the immunity even after the first dose. The reason why it was changed to 3 months was from a public health point of view. Given the situation with coronavirus at the moment, numbers of people in hospital, the number of deaths that are increasing, then the logic is, at least if you can maximize the number of people that you can vaccinate with 1 dose and give them some protection, then that is better than giving fewer people the 2 doses while the situation is as bad as it is at the moment. And we know that even after the second dose with the Pfizer vaccine, it goes from 90% or 89% to 95% with the second dose. So your gain is not huge, but you do need to have a second dose. And for the Oxford, it goes up from about 74 to about 90% as well. So you're not losing out hugely by not having it within 3 weeks.
Okay, lovely. That's very helpful. Third question. I mean, lots of people have had COVID. As a consequence, you acquire antibodies. So the question is, if I already have the antibodies, should I have the vaccine?
So first of all, it's a new disease, and we're learning more about it all the time. And certainly what's been shown from studies is that antibody levels that you have after an infection begin to go down. And so they actually go down within about 5 to 6 months. And so you could get reinfections. So we're already seeing people that had COVID before getting reinfections. And so the answer to the question is yes, you should have the COVID vaccine. And that's why I have the COVID vaccine as well, because I work in an environment where I'm always exposed to patients that are likely to be infected. And also, we've got new variants. So we've got the new variant of the coronavirus, which is far more infectious than the original variant. And so, from that point of view, being protected with a vaccine which stimulates your immunity maximally is important. So the answer is yes.
Yeah, lovely. Okay, thank you. Next question. If I've had the vaccine, will this prevent me from carrying or passing COVID-19 to others?
So again, to reiterate, it's a new disease, a new vaccine. It's not been around for a long time. What we do know is that by having the vaccine, it reduces your chance of having severe coronavirus disease and ending up in hospital and severely ill. Some people may not get the disease at all and they're fully protected. Some people may get mild symptoms. So you can get mild disease. So it's not known yet, and studies are still carrying on whether you're a carrier, you can be a carrier without knowing it, despite the vaccine, or if you have mild symptoms of the disease, whether you can still transmit it to other people. So these are questions still unanswered yet. However, what is definitely known is that people who have the vaccine have a milder illness, if at all, after having had the vaccine.
Lovely. The next question is around does the vaccine affect fertility? And in the chat, Fatima is asking, some female staff that have of childbearing age are asking about the vaccine. Does it affect fertility? So does it affect fertility? And would your GP recommending not having it because of any fertility issues?
So the answer to that is there's certainly no evidence at all that it affects fertility in men or women. In fact, when they first started, and when I say first started, that's only a couple of months ago, the recommendation was that people didn't get pregnant within 2 months of having the vaccine. But that's now been changed, and it's changing all the time because the safety profile is showing that it has no real problems related to pregnancy or during breastfeeding as well. However, those people that are going to be in that range, unless they're key workers, health and care staff, will have to talk individually with their doctors before they give consent, because the information is changing all the time. But the information is heading in the direction that it's actually safe. The vaccines are safe in pregnancy and in during breastfeeding. So I wouldn't worry about the fertility side or in terms of pregnancy, because the information that we have and the evidence is that it's safe. But the guidance is changing all the time in terms of vaccination.
Yeah, that's lovely. Thank you. We've had a number of questions on that very issue, so that really helps. Next question: does the Pfizer vaccine have a side effect of a tightening of the chest?
So all vaccines, whether they're the coronavirus vaccines or the flu vaccine or any other vaccines, can give you localized symptoms in the arm, soreness or redness. Might give you a slight temperature or muscle pain, but it's not actually giving you the disease. And so, although it's not a common symptom, and I've not seen it written down as a common symptom either, then it is entirely possible, but it's improbable. The common side effects are mild symptoms relating to the local area that the injection was given in, or a mild temperature or headache, which all settles down within 48 hours.
Okay, lovely, thank you. So next question, there are now 3 vaccines available, and there are more in the pipeline. But of the 3 that are currently available, 2 being used, one in the pipeline, which are the most effective, which carry less side effects?
So they're all effective, and that's why they've been passed by not only just the UK Medicines Agency, but also now the European Medicines Agency, and also by the American Medicines Agency. So they're all safe and effective, and independently being looked at by different bodies around the world now. And the effectiveness to give you the protection you need is in the region of 95% after the second dose for the Pfizer vaccine, about 90% for the Oxford AstraZeneca, and probably for the Moderna vaccine when it comes out in the spring. It's not available yet. Then it's probably going to be in the region of about 95% as well. So remember, nothing's going to be 100% because we all respond differently. But that's a really good level of immunity, better than vaccines in the past. So that's why the scientists are really quite excited by the outcome of the vaccines.
Okay, lovely. And do we know when the Moderna vaccine is going to be available?
Yes, so the government has purchased a few million of those, but we don't anticipate that arriving in the country till about the spring.
Okay, lovely. So they were all the questions that have been issued to us previously.
Can I just say about the vaccines as well?
Absolutely, yes, yes.
So the reason why it's kind of been slow to get the Pfizer vaccine into care homes is because the Pfizer vaccine and the Moderna vaccine, but different temperatures, have to be at very cold temperatures. Because they're RNA vaccines, you can't move them several times, and you've got to be gentle with them in terms of any traveling. So that's made it difficult to take them out to the vaccination sites, although in cold bags they have been, and some care homes have been done already. But the Oxford AstraZeneca vaccine is far easier to give in care homes, and so now that that's available, it's going to really be ramped up, and I think it's anticipated certainly that by the end of January, beginning of February, most, if not all, care home staff and patients will have been vaccinated.
Yeah, lovely. I'm just running through the chat. We've got a question here from Annette Sterling. What can we do that we're not already doing to keep our immune system healthy to prevent getting COVID? So is there more that people can do?
So I think let's just say, when you have an infection, however good your immunity is, it will be breached. So staying totally 100% fit and healthy, your chances of getting COVID are still there. And the way to keep as fit as possible, because it's about recovery. So the fitter you are, the quicker you'll recover, and the symptoms may not be as severe either. So a healthy lifestyle, diet, fresh fruit and vegetables, exercise, and weight loss are really key elements to preventing the severity of the disease. But there's no way that if you're infected by it, there's no way you can prevent getting it just by having boosting your immune system.
Yeah. And again from the chat, Joseph is asking, can anyone who suffers with any form of allergy take the vaccine?
Yeah, so in the initial guidance, it was about anybody who had allergies, and then it became anybody who had anaphylaxis, which is a severe form of allergy. And now that guidance is even changed since then. It's really only people who've had anaphylaxis to the ingredients, and the ingredients of the vaccines are quite innocuous as well. So there's unlikely to be many people who've had any reaction. So the type of allergies we're talking about is not just ordinary allergies where you get a rash or anything like that. It's where you have a severe anaphylaxis, which is a life-threatening allergic response that ends up in hospital, and you need to carry an EpiPen because of that. But remember, none of the vaccines have any animal products in it, don't have egg or anything like that, and actually the likelihood of people being severely allergic to it is going to be minimal.
Yeah, lovely, thank you. Again from the chat, Krista is asking, can people with sickle cell trait or sickle cell anemia have the vaccine?
Simple answer to that is yes.
Okay, lovely. Anura also from the chat, there's a significantly large proportion of healthcare staff declining to have the vaccine due to various reasons, including skepticism. And we saw this also with the flu vaccination programme. Yeah. Are there any national campaigns or active steps being taken to educate these staff?
So I think it's not just individual staff, it's also what they're being exposed to.
Yeah.
And I'm on a number of different groups, including Black and Asian minority groups. And the amount of conspiracy theories that are circulating and fake news is huge.
Yeah.
I think there's a simple message really to get across, and it's not always easy to do that. And this is a real condition, it's a real disease, and it's a life-threatening condition. COVID is real, and the hospitals are full at the moment. And we had all these videos of showing empty hospitals in corridors in the night, and canteens. You wouldn't find patients in the canteen at night or in corridors. Whereas the wards now, most hospitals are over half their beds are taken up by coronavirus. And if you watch the BBC News yesterday, you'd have seen, and certainly we can share the link, the BBC interviews and filming at Croydon University Hospital, which actually showed what was going on. So, this is not all made, and I think health workers in hospital and everywhere really feel deflated when people think this is not real and that everybody's conspiring and there isn't anything like the crisis there is. And I think it's a clear message to get across to people. You have to make an informed decision whether you have the vaccine or not. But it's important to get the right information. And WhatsApp and social media is not always kosher information, because it's easy for things to go viral. There's no vaccines. The vaccines can't change your DNA. They don't have any microchips in them. It's nothing to do with 5G. There are huge amounts of fake news going out there that make people concerned about it. But the reality is now, apart from the trials, which had 40,000 for each of the vaccines, we've now gone to nearly 2.8 million people in this country alone. And people haven't developed two heads. They've still got two arms. They suddenly haven't become zombies. So I think there's a reality check that people need to see. And at this moment in time, if we can encourage people to get the right information, give them the right facts, then I think they will be able to make their decision in terms of having the vaccine. And I think the other point to make is it's not just to protect yourself. So it's about protecting yourself, but it's also protecting your colleagues that you work with. It's protecting your families, and if you work in care homes, it's protecting your clients as well. So there is a point that we will reach herd immunity because of vaccination, not because of the disease, but because of vaccination. And if we don't get that herd immunity, about 80% of people vaccinated, then this disease will still circulate. And the disease is still circulating. There's more opportunity for it to mutate and have strains that cause more serious disease than we have now. And we know the current variant is affecting younger people more, healthier people more, as well as older people who are debilitated. So it's real, it's serious, and people need to get information to help make up their minds about having the vaccine.
Yeah, you couldn't be clearer, and that's really, really helpful. Again, from the chat, another question: if you've already had your first vaccine, will you have to have the same make for the second vaccine, or can you mix them due to availability?
No, so the current guidance is you have the same one.
Yeah. Also from the chat.
Cool. Could I just ask Mercy and Chunwa, thank you. It's really lovely to see your faces, but we can see everything you're doing. Would you be able to put your cameras off, please? Thank you very much for attending as well.
Yeah, that really helps because the session is recorded. Just another question from the staff, from the chat. Staff would like to know, what is actually the vaccine? So what is it?
So there's three different vaccines. So the two that we've got at the moment, it is actually 0.3 mils or 0.5 mils, depending if it's the Pfizer or the AstraZeneca, which is injected into your arm. What it contains is chemicals that help stimulate your body to create antibodies to the spike protein of the coronavirus, and that's what it's doing. It's presenting. It's not giving you the disease, but it's giving your body the opportunity to recognize a coronavirus if it's exposed to it in the future by stimulating the immunity of individuals.
Yeah, lovely. Again, that's very clear. Another question, this time from Joseph. Will you advise a staff who has taken the vaccine and is suffering from side effects to take painkillers?
Yes. So just like in any other vaccine, really. So simple painkillers, paracetamol or Nurofen, will help with the symptoms, because symptoms usually settle down within 48 hours, as said, on average.
Yeah, lovely. This next point goes back to the early point that you've made. This is from Jason. Staff have asked how long the materials of the vaccine stay on your body. Does it affect your DNA?
So I think I answered that question,
Yep.
because that's the one that's been circulating for a long time. So those that know their basic biology, the body, the cells are created by the DNA. The DNA is within the cells. The RNA, which these vaccines are make proteins. So there's no way that the RNA can alter your DNA. So it's the other way around. So DNA produces RNA, not the other way around. So there's no way it could ever affect your DNA. And secondly, once the RNA has done its job of stimulating the cells, it becomes denatures and dissipates. So it doesn't have any medium or even long-term effects in your body.
Yep. Lovely, thank you. And again, this next question, I think you have already answered. Can someone trying for a baby take the vaccine?
The answer is yes, and the evidence is growing more and more that it's safe before, during, and after. But again, more guidance is coming out all the time, and I think it's important to keep up to date with the guidance. And certainly, it's becoming more applicable that we're not excluding people in those categories.
And a final question from the chat, again from Joseph, and it's really important to these are the questions that are coming from the staff, so it's really helpful to answer these. Again from Joseph, how long does long COVID last after having COVID-19?
So that's the $20 million question.
Yeah.
Because it's such a new disease. What do we mean by long COVID? So if you have it severely, and even if you don't have it severely, those that have it know that the extreme tiredness, the muscle weakness. I've never spent so much time in bed as I had coronavirus. Your muscle pains can persist. You still feel extremely tired, but it has other effects. It can affect your heart. It can affect your lungs. Can affect your kidneys. And these are things that we are only learning about because it's a new condition. So you get over the COVID, but actual acute disease, but you could be left with all these other symptoms. And that's why more and more work and support is being given to people after that. And it's called long COVID. So how long is nobody knows at the moment, but it does persist considerably long time after.
Yeah, sure, lovely. Thanks for that. Just one final question from the chat. When will family members, including children of key workers, home care staff, be offered the vaccine? Do we know that yet?
So for every 20 patients in a care home that you vaccinate, you save one death. For every 600 people you vaccinate in the over 80 category, you save one death. So if you start going down the age groups, so obviously, that we've had about 600 NHS staff who have died already because of coronavirus, which is quite a significant number. So there is a grading in terms of groups. So group 1 will be the care home staff and patients. Group 2 is the over 80s, and group 2B is NHS staff or health and care staff. And then you're working down to the over 75s and downwards as well. So effectively, those groupings are on the public websites that you can see, and people can work out when they're likely to. So this is not going to happen quickly. It's going to take some time, but we need to get those really vulnerable groups vaccinated as soon as possible. And I think the government has set its target in the next couple of months.
Yeah, lovely. We can provide those links to that website in the Q&A as well, so people will have that on Friday, but it's in the public domain already. So I think before we move on, are there any other questions from anyone? If anybody wants to raise a hand whilst we've got Dr. Fernandes, I think Dr. Fernandes is going to stay to the end of the session anyway, if there are any general questions to pick up on. But if there's any queries out there, we can respond to now. If not, thank you very much for joining us for that session. That's been incredibly helpful. It's really good that those questions are coming directly from staff. So those on the call will feed those responses back. Plus, we'll capture them in the Q&As on Friday. Sam, you're asking a question. We'll pick that up now. Sam Sprigg, you've got your hand up.
Can you hear me?
Yes, we can. Yes.
Yeah. Oh, sorry. It's just really to ask about, we have a number of staff members who are quite sensitive about the vaccine, and it's being offered to them. We're sort of anticipating that some people might not want to tell their colleagues about it, but nevertheless probably have something of a duty to tell their managers if they have been vaccinated or not. I just wondered whether you might be able to comment about levels of privacy here and what we should do about that. Can people keep it private, or should they tell their employer if they are being vaccinated or not?
So I think people who are vaccinated will be quite happy to tell their employer and everybody they've been vaccinated, because they'll have a vaccination card, which will be as important as a passport if you want to travel around the world, I would have thought. And it's people that don't want to have the vaccine that are more of an issue. And I think it's about what further information and what support do they need to help them make an informed choice. Because often people get their information from social media and friends and relatives, and rather than the actual true facts. And it's that misinformation that makes people hesitant and makes them worried about taking a vaccine. I mean, even though if you watch the mass vaccination sites opened yesterday, you've got a cohort of people, thousands of people, that want to have the vaccine and queue up for it, and then you've still got a few people that absolutely don't want to. So it's a bit of a paradox. And I think we need to make the information available to people that they want it in the form that they want it, and to ask questions. So this kind of webinar is really helpful, where people can ask those questions, because if they get the misinformation they do from social media and other sources, then they feel reticent doing that. Now, in terms of privacy, the government has said it's not going to force anyone to have vaccines, and that will be really difficult. So, North Korea. But there's something about North Korea where actually people did have the vaccine or having the vaccine, in this country and in democracies, you really need to give people the information to make the choices themselves. But I think as an employer, as I said before, having a vaccine not only protects you, your family, but also your colleagues that you work with, and also the people that you work for in terms of the clients. I'm sure this is a question that's been asked in all workplaces, including in my practice. So what do we say to people that don't have the vaccine and then become ill? Because if they don't have the vaccine, they're actually posing a danger to their fellow staff, as much as to other patients. So it's a really difficult question. I haven't got an answer, but there's a lot of discussion still to be had.
Lovely, thank you very much for that. That really helps. I know, Dr. Fernandes, you're going to stick around until the end of the session, but if we can move across to Jiggy. Jiggy, you're going to spend a bit of time talking to a chap called Eric with his first-hand experience of also having had COVID. So, Jiggy, over to you.
Thank you, Paul, and thank you, Agnello, for joining us. I think that it's been brilliant, the answers so far, that really helpful, and will help people to make those decisions to have the vaccine. And I know you'll be joining us shortly past 12 if the questions run over. So thank you for saying that you can join us for a bit longer. Okay, I'm going to move on to Eric. Eric, thank you as well very much for joining us today. I wanted to bring you here, well, we wanted to bring you here to ask you about your experience of having COVID, because it's really, really important right now to share your story to people, because I think most people, if not everybody, knows somebody who's had COVID, and some people have mild symptoms, some people don't have any symptoms at all, and some people react very badly and have COVID that affects them completely and affects them very badly. So I wanted to start with thank you for joining us and sharing your experience. Can I ask you a few questions about what happened to you? Firstly, can you tell me a bit about yourself?
Hi, can you hear me?
Yes, can hear you.
Hi, JK. Thank you for having me. So my background is 22 years in nursing. I'm currently a deputy manager at the care home in South Croydon. I contracted, which I think COVID end of March, which I had mild symptoms, but beginning of leading the way to Holy Week, I think it's beginning of April, I just couldn't remember. A friend of mine went to visit me because they were very worried that I wasn't answering their texts and calls. And my friend, who's also a nurse, found me in a very serious condition. And he immediately, at that time, the ambulance was so busy, they couldn't get me to the hospital. So my friend took me by taxi. And from then I was sent to Princess Royal Hospital in Bromley. Princess Royal University Hospital in Bromley, and immediately I was sent to resuscitation unit. And within that day, from resuscitation unit, they struggled to give oxygen to me. I was on CPAP, and then I was moved to CCU, and then after a couple of hours, same day, I was moved to intensive treatment unit, where I was medically induced coma, was put on medically induced coma, and I was intubated. For 5 days, I was in Princess Royal Hospital. They're struggling to put oxygen in my lungs, so they called. They referred me to King's College Hospital in Denmark Hill, and the ECMO team went to see me in Princess Royal Hospital, and then they moved me from Princess Royal Hospital to King's College Hospital in the liver ITU. That's when I spent.
Can you say a bit more about the ECMO, because I've read a bit about it since I've spoken to you, but I think a lot of people here may not know what the ECMO is.
Yeah, so the ECMO is extracorporeal membrane oxygenation. In my situation, so they've inserted a large. So if you can see, there's a scar in there. So they inserted a large tube in my neck, and it was attached to a. What it does, I think, is it draws blood, and it goes to the blood goes to the machine, and the machine oxygenates the blood, and then the oxygenated blood returns to my body, and that's how I got my oxygen from, because the normal oxygen. I was still struggling because I had severe COVID-19 pneumonitis. So my lungs were badly affected. About 75% of my lungs were infected.
And
What other parts
of your body were failing as well?
So my kidney failed, so I had to go through dialysis whilst I was in ITU. So I was also under the care of the cardiology department because suddenly I had this high heart rate, so tachycardia. So I was also under the care of ophthalmology because I had keratitis, and important. I was actually in coma for 4 weeks, and I spent another 4 weeks, 4 weeks doing rehab, intense rehab. So overall, I had 2 months of hospital admission.
So when you woke up, actually while you were in the coma, you mentioned that your family were contacted as well because they didn't know that you were going to make it through.
That's right. Yes, it was very hard, difficult for them, and obviously with the lockdown, my only next of kin lives in Isle of Man, and she couldn't even, come and visit me, even though the consultants had agreed that she should visit because they think that I wouldn't make it. I think they only gave me a 30% chance of living because they already gave me 100% of oxygen therapy, and I was still desaturating, and I think they were just hoping that ECMO would help, and I think it did. So during that time, it was so difficult because when they said, I might not make it, so my family actually planned for my funeral that time. Yeah.
That's really hard to hear as well, and difficult for everybody to go through. I know that the ECMO machine is only available in a few hospitals in the country, so it's really fortunate, and I'm so glad that you were able to have access to this. And as more and more people are now going into hospital with COVID, the chances of having access to this kind of therapy and machinery is getting less and less as things become overwhelmed. Can you tell me as well? I know that obviously it's affected your health and your physical body. How you said you had the tracheostomy, you've had the tube from the ECMO machine into your artery through your neck, and then obviously you'd been in a coma, so your muscles weren't being used for those 4 weeks. So you had to kind of relearn how to walk and how to do everything. So physically, your body has been impacted, but how have you been impacted otherwise?
Well, it affected me, emotionally, psychologically, even spiritually, socially, financially. It affected me in all so many ways.
Yeah.
Whilst I was back in June, I did struggle when I was discharged from hospital. Like Dr. Fernandes had said, I've never spent in bed so long. I was off for 16 weeks. I lost my dad in June. Um, Obviously, with the pandemic, I couldn't, and also, with my health, I couldn't travel back to Philippines to pay my respect. But yeah, it really affected me. So, emotionally, psychologically. That's why after another 8 weeks of getting better, I decided to go back to work. And work keeps me afloat actually, and yeah, I'm just so glad that I've got a work to go back to, and doing the things that I love, which is nursing. So I'm passionate about my work, and this is the only thing that keeps me afloat this time.
Thank you. And it's such a personal story to share with everybody, so thank you so much. I have another question. If you had been offered the COVID vaccine before you ever had COVID, what would you have said?
I probably wouldn't. I probably would say. Well, I'm pretty sure actually. I would say yes, because every year I always have flu vaccine anyway, and I do believe in vaccine. And when this pandemic started, just didn't realize that it affected me and I contracted it. And had the vaccine been ready by then, I would definitely be the first in line. And actually, it's been offered to me now.
Sorry, Eric, you just
had.
Eric, sorry. Would you be able to turn your camera off, because you're just breaking up on your end? It might be the broadband or
Yeah.
Sorry, Eric. Thank you. Sorry, you can keep talking. You said you were offered the vaccine now.
Yes, I was offered the vaccine. As a matter of fact, I had it last Sunday. So I went to Croydon University Hospital. I went last Sunday. Had my arm is a little bit sore, but I expected it as well as I've expected with my previous flu jabs. So yeah.
And thank you so much for sharing that. And could I ask as well, how you mentioned before how careful you were with disinfectant and hygiene and things, and how you took many precautions. So you don't know where you'd contracted COVID, but how easy it is and how you can get it from. You just don't know where you got it from. But could you tell us a bit about the precautions you took beforehand?
Yeah, so when at the end of January, I started buying alcohol, and I've been doing spraying all my flat, and I've been deep cleaning my. I live on my own, so I didn't go out much apart from work. So I've avoided going to the shops. So I had mine. I've delivered mine. All my shopping delivered online, and as a very I was very cautious. So all the deliveries I have to spray with alcohol and leave it for 72 hours before I take them in. So it's lying in my porch. So after all that, I still got it, and I still don't know how I got it. It's still a mystery.
So you know how important it is to follow PPE and wear a mask and wear gloves when you're doing certain procedures, and you know how important that is, and still somehow the infection chain was broken and you contracted COVID, no matter how much you did. So how brilliant now that you've now had a vaccine as well. So thank you. Thank you for sharing your story with us, Eric.
You're
can come
welcome.
on camera to say bye if you want to everybody. But it's lovely to have shared your story, and you're welcome to stay for a bit longer till the end of the webinar too. And I know that we're going to be moving on now to some more questions. If anybody wants to ask a question to Eric, you can add that into the chat. But we'll go back now to Dr. Agnelo Fernandes with more questions that have been coming in the chat. And if you have a question to ask via voice call, because you can't add into the chat, then I'm sure Paul will go through those with you too. Thank you very much.
Thanks, Jiggy. So if we could go on to any questions, please put your hand up if you want to, if you can't use the chat. We've also got Debbie Calver on the call, who's been answering questions in the chat also. We'll run on till about 12:15 if we need to. So I'll review the chat as well. But any questions?
Paul,
yes,
can I just
of
make
course.
a point? I mean, Eric prompted me. So, when we're working in health settings or in care settings, in care homes, the importance of IPC, infection prevention and control, wearing our masks everywhere, following hand hygiene and everything else, is so important. And when I caught the condition, I thought, where did I get it from? And it certainly wasn't in the surgery, because my wife got it at the same time on the same day. We both tested positive. So the incubation period would mean that we both got infected at the same time. So it wasn't in a health setting that we got infected. It was when we went to help out, eat out to help out. And that's the time that you know, we both got the virus. So it's really important, the point about hand hygiene, masks, all the infection prevention control measures, because this virus variant at the moment is really infectious. At the moment, I've got 5 of our staff in my own practice off because they've caught it from somewhere, whether they've been shopping or elsewhere. But you know, insisting in the practice that they are really strict with infection prevention control is really key, and that goes for every health setting, really.
Yeah, lovely. No, that's really helpful context. Thank you, Eric. I need to say you're getting star reviews for your session. There's yeah, what you've said has really gone down very well. Thank you very much. Debbie, I see that you've been answering some of the questions around PPE and IPC. Is there anything you want to add? You're on mute, Debbie.
Hello. No, I've got nothing really to add. I just think that was an absolutely fantastic session. Thank you so much, Dr. Fernandes. It's really gone down well, and lots of people are asking whether there's recordings that they can take back to their staff, because obviously we've just got a handful of, we've got 117 people at the moment on the call, and we've got 260 something care homes across Southwest London. So we want to spread your message far and wide, really. So I know that's gone down really well, and I hope you'll come back at some point and answer some more questions as we get a bit further down the line. Yeah, but I'm here if anybody wants to ask any particular questions, or we can ones that we haven't answered, we will put into the frequently asked questions, and I'll answer them in the next couple of days, and they'll come out on Friday, so you'll be able to see them. But otherwise, come through the generic email and infection control at Southwest London, swlondon.nhs.uk, and we can help you that way. Lovely,
thank you.
There's a question in the chat about can you have the vaccine if you're immunosuppressed?
Yes.
The answer to that is a definite yes. Obviously, your response may not be as strong, but if you're on chemotherapy and or any other cancer treatments, it's important to discuss that with your oncologist. But in general terms, the answer is yes. It's not a contraindication.
Yeah, lovely. Thanks for that. So, are there any more questions? Normally at this time, there's loads of questions.
We've got
oh, have we? Sorry, you can see those. Carry on, Jiggy. You can see them.
Rosemary, please.
Hi, good afternoon, everyone. Can you hear me okay?
We can.
Yep.
Yeah, thank you. Yes, I'm Rosemary from Shenash Home Care. Our service provides care to people in their own homes. So I've got staff going into different people's homes. I have a few of my staff that have agreed to take the vaccine. We've got 3 going in today. But the problem we have is we have a large number of staff who are saying they can't take the vaccine because of their religion. So they are, because, and these are people that of Muslim religion. So I would like to have some information, please, about how we can speak to these parents about what the vaccine entails and whether it will violate their religion in any way.
Shall I answer that one? I'm sorry, I missed that one out, because there's been so much from the Muslim Council of Britain and all over the world. As you know, the Saudi king had his vaccine as well. So all the imams are totally supportive of it. And as you know, Israel is vying with Britain for the most number of vaccinated patients. So from a religious point of view, even from a point of view of Jehovah's Witnesses, there's no issue. So it is halal. There is no animal products in it. And so there's no religious reason why people should not want to take the vaccine. There are things, there's a lot of information available on that, and certainly we can give you some links to that. But there's no religious reason at all for not having the vaccine, for whatever religion at the moment.
Thank you very much for that. Very helpful.
Thank you, Rosemary. Is there anything else you want to ask before I go on to the next person?
No, that's all. If you can just kindly share the link, please, so we can share it with those staff, that would be great.
Yes, and I'll put further information into the FAQs at the end of the week too. Thanks.
All right, thank you.
And thank you, Dr. Agnelo. Dudley.
Hi everyone, thanks for having me on the call. First and foremost, just to say thank you for Eric and his story. It's been a great story. I know firsthand a lot about the ECMO machine, and I think there's only 16 available in the country, so he was very fortunate to get one. So everyone should be aware that it's not, he was very lucky, and then it's something that we give thanks for. Other question I wanted to raise with the doctor or anyone of the professionals on the group on the call is obviously the latest vaccine that came out was a Moderna vaccine, and there was a lot of chat that it may be able to provide you with 2 years immunity from having this vaccine. The question is, with a lot of people who are having the vaccine, is really the length of time they will have immunity in having the actual vaccine. I know it's in 2 doses, but long term is my first question. And the second question, which probably no one knows the answer to, is it potentially able to get coronavirus twice or more than once?
So shall I just answer that in terms of the vaccines? So these are all new. So a lot of it is speculation, although there is some evidence that might back it up. So the answer is we don't know at this stage. We can look up to a year ahead, and given that vaccines like the flu vaccine can last that period of time. But remember, the reason why we have the flu vaccine every year is because the flu virus changes. And we know that coronavirus can change as well. So we know that the spike protein might change. So you may need to have vaccinations more frequently. About 2 years is, again, it's speculative at the moment. We don't know. There's no evidence yet. But, you know, I think the point about the second part of your question is relevant to that as well. So the answer is yes, you can catch coronavirus twice, and we're getting more and more cases of people getting it. So we have the original coronavirus, and now we've got variants. So as I said before, you may have had the disease once, but your antibody levels start to go down. If you've got a new variant, you might, which is more infectious, then you can get infected again. So that's why the vaccine is more important, to try and build up your immunity that can cover the old variant and the new variants that we got at the moment as well. And the evidence so far, and there's more work being done, is that the vaccines that are available now cover the old variant of the original coronavirus, which itself is a variant, and the current Kent variant, the one that is spreading the disease exponentially across the southeast and across the country. So if we and the South African variant as well. So vaccines are more protective, but coronaviruses are going to change, and that's what viruses do. So the answer to the 2 years, I don't think we're in a position to answer that yet.
Thank you.
Thank you, Dudley. Did you have any more questions to ask Dr. Agnelo Fernandes?
Oh, sorry.
Sorry,
I'm not sure. So just the other final point is I'm involved heavily with trying to give the education to the BAME community on the vaccine, and there's a lot more obviously information required and being put, and I think a lot of the time it's being put in layman terms because a lot of the people don't understand the language that maybe a lot of that goes on television, or what the doctor's language is, spike and so forth. So it's really trying to put something in a really simple format, which is really something where they can understand and digest, which is really a thing that I think a lot of staff would require.
Yeah, so I totally sympathise with you, and as an Asian person myself, this is really something close to my heart. This is we've done 3 webinars already, and you know, the Black and Asian community are skeptical. There's certain members of them, But I think we're getting through to the Asian community more, but we're not making much headway with the black community. And you're absolutely right. We have to ask the question. We have to try a different approach to this. I think there's three fundamental questions to answer. Is this real? And I think the answer to that has to be yes. And what evidence do you need to give people that it's real? My suggestion would be watch the BBC documentary that showed Croydon University Hospital yesterday on BBC News, and that should tell people this is real. The second question, is it serious? And are these figures that we get from the government about number of cases and number of deaths real? The answer to that is absolutely yes. If you want to triangulate it, speak to undertakers, because they see the bodies. The third thing is it serious for BAME communities? The answer to that is also yes. Now, I won't say which hospital, but in one hospital in southwest London, where the BAME population is not particularly high, 75% of the patients with COVID in the hospital are black. So, those are questions that I think we need to try and get across to people. So it's giving them the evidence in a simple way that this needs to be taken seriously. And then the other bit is about the safety of the vaccine. And, I'm on BAME groups locally, regionally and nationally. And so I get all the WhatsApp messages that circulate about all the sorts of things going on, and trying to give the other side to it in terms of why it can't work. The DNA one has been circulating for a while, hasn't it? It keeps going round and round in circles, but it scientifically just cannot work. RNA cannot change your DNA, and RNA is dissipated, after a while anyway, so it hasn't got any long-term effects. The other is that this is all to do with conspiracy theories to try and control you by having nanobots inserted in the vaccine. That's another common one that, again, there's no evidence of it at all. And the other thing is that because this fear of changing your DNA, all those of us who've been vaccinated, we're still the same as we were before. We haven't mutated to some different form of human being yet, and we're not likely to either. So I think it's important to get those simple messages across to people. But I think the most stark way of doing that is showing people sick people, and the number of sick people and seriously ill people and people who are dying are black and Asian. They're getting younger as well. And there was a person who was interviewed yesterday who was a young, fit person, and the new variant is actually affecting younger people as well. So it's about how do we get those messages, which are factual, across to people, and then they can challenge the WhatsApp messages they get on those grounds. The ones that filmed, and I recognise the voice of the person who filmed in Croydon, filmed the annex and the canteen area, filmed the corridors that were empty in the night, and said, these hospitals are empty. But you wouldn't expect patients in the corridors or in the canteen or in outpatients at that time of the night, or any time of the day or night for that matter. When in fact, in Croydon Hospital, more than half the beds are taken up by COVID patients. What that means is that it means that patients who have heart attacks, strokes, cancer, all sorts of other things are being affected because the hospital can't, or the NHS can't function. So it's not just people who got COVID. The knock-on effects of this is, and the other point is, it's not because the NHS staff are tired, therefore we need to protect the NHS. The reason why NHS staff are really concerned is because of all the other people that we're not able to deal with, and those people have still got the problems. I know in GP land, certainly we've got lots of people who've still got their heart problems, their diabetes problems, their neurological problems, their arthritis and the rheumatoid and everything else, as well as acute heart attacks and strokes. So, these are the messages I think we need to get across. And I totally agree that we need to have a different approach to our black colleagues in terms of getting the messages across in a factual way, so that they can make up their minds with an informed choice about taking the vaccine and the benefits of doing that for them, their families, their colleagues, and society in general.
Thank you, Agnelo, and thank you, Dudley, for asking that question, because I think that it's really important for for this to get out there to every single community, especially those who are not hearing it as loud as they should be. But I know that we're running over, and thank you, Agnelo, for staying on. We do have some more hands up. I wanted to draw everybody's attention as well to the new booking form for the COVID vaccination for care home staff and social care staff and dom care staff. The information on there, if possible, could you provide your NHS number if you do know of it, and all the information in the different cells that are available. The last one was sent last Friday, and it has been updated from the one that has been sent in the past. So please when you do fill that out to get your COVID vaccination, and send it to carehome.covidvaccine at SW London. I think I'll put the actual email address in the chat rather than say it out loud because I can't remember it. But but please send all the information in that booking form that was sent out last Friday, and we'll send it out again this Friday. I would like to go back to you, Agnelo, if you still have time to stay with us with a few more questions. Are you okay to stay on?
Yeah.
Thank you.
I'm already late for my meeting, so a few more minutes won't make much difference.
Thank you, Agnelo. We've got Gavin.
Yes, hi. Thank you again very much for Angelo and Eric's presentations. I think both are worthy of recording and being available for care homes to use. My questions actually are on the, well, two questions. Lateral flow device test, first of all, probably one for Debbie. Following a positive lateral flow test, you do a PCR test. When you get the result of that, if it's negative, can the person return back to work before the 10-day isolation period ends?
Yes, that's right. So the PCR is a definitive test. So LFD gives you the heads up, and then you cross match that. So they start the isolation, then take the PCR test. And if that is positive, then you start to isolate from the date of the first test for 10 days. If you're a staff member, for 14 days if it's a resident, and if it's negative, you can come out of isolation.
Thanks. I heard from one other group, quite a large group, 8 homes, that where they've done that, positives in lateral flow tests have turned, in all cases, positives to PCR tests. But anyway,
sorry, say again. So
tested with, first of all, with the
LFD, yeah,
lateral flow devices. When they've done a second one, it's always been positive so far.
Always been.
That's anecdotal, perhaps, but that's what I've heard.
Yeah, no. Can I just come in there? The answer to that is yes, because a positive test is highly likely to be positive.
Yeah.
Whereas a negative test doesn't give you the reassurance that you need.
Yeah, hence continue weekly PCR tests. Yeah.
Right. Yeah.
Another technical question, I suppose. When a staff member has to isolate because they've had a potential or actual PPE, say mask breach, with a positive tested staff member, can they come back? And then obviously they have to isolate for 10 days. Can they come back if they have a test while they're isolating if it's negative?
No, because they could incubate for up to 10 days. So you need to have the full 10 days isolation.
Right, that's really helpful, that last one. Okay, well, it's been helpful. Thank you very much.
Thank you, Gavin. We've got Sam. I'll just wait for you to unmute yourself, Sam.
Hello, thank you. I just wanted to check if any of you can comment about when it's likely that the vaccine may be rolled out to staff doing slightly less critical services, like working with vulnerable people in day services or employment support or travel training, that sort of thing.
Jiggy, can I come in on that, please?
Yes, please. I was just going to ask. Yes, go ahead, Dave.
The most important thing is if anybody's having any resident contact in any shape or form, they can actually refer themselves through to the COVID vaccination single point email address, and they'll be put forward through for the vaccine.
So whether that's people who are going in to look after vulnerable patients in their homes, or any contact anywhere, if you're working in social care, care homes, dom care, everybody.
The new booking form enables you to highlight if you're dom care or social care workers. So you're able to go through for the vaccine in exactly the same way as care home staff as well.
Okay,
we're trying
that's
to get anybody that has direct contact with residents.
Great, thank you very much.
And that includes contractors or people who are coming in to work in the care home who are not directly constantly in contact with looking after residents, but if they work there and they do have some contact, then they can also go through that point too. Okay, so thank you, Sam.
That will include chefs and cleaners and people that do the laundry and everybody within that environment, because they all have the potential to bring in the virus into the care home and shed the virus while they're there. So absolutely.
Thank you for clarifying, Debbie. Thank you. Thank you, Sam. Was there any other questions you wanted to ask?
No, that's great. That's very helpful. Thank you very much.
Thank you, Sam. We've got Lucy. Lucy Sage.
Yeah, I just wanted to ask, for example, one member of our staff was tested positive with a PCR, and then after you challenged them, and that was, for example, last Friday, and then after that, she done again the test because you challenged them to make sure that you are, what's the real result. And then you done it again on Monday, and it says there on Friday it was positive, and then on Monday the same PCR test was negative. The result was negative. So what are we going to do about that one? Right. Do the staff need to isolate or?
Absolutely, absolutely. When you take a positive PCR test, you must isolate for the full 10 days after that test, and they can't come back to work until they've done their 10 days isolation and they have improving symptoms, if they have symptoms at all, and they should be without a temperature for 48 hours. We should not be retesting any people that have been positive for 90 days after their first positive test, unless they have new symptoms, and if they have new symptoms, then yeah, certainly you can retest. But this is where the confusion starts, and people shouldn't be wasting resources by going back and challenging test results to see whether they're accurate or not accurate, because that makes everybody an expert, doesn't it? And actually what we know, the evidence says that once you've tested positive, that is likely to be an absolute positive, and you must then isolate for 10 days after that positive test. And you owe it to yourself, your colleagues, and the vulnerable residents that you're looking after. It's really, really important now that we all follow the rules and stop trying to manipulate the test to sort our particular situation. I'm sorry to put it so bluntly, but it's really, really important that everybody does the correct things and follows the national guidance. The national guidance is there because it's evidence-based. It's what we know at the moment. It may change, but it's what we know at the moment. So it's really, really important that we follow that. Would you agree?
Thank you. And one more thing, for example, the same time your family, your household family was tested, but they were negative. So that means they need to also isolate the same time?
Absolutely, yes. So if you've got a positive test and you're in isolation, then you're in isolation for 10 days. Then your family that you're living with will then need to isolate for another 10 days as well, from the date that you got your positive test.
Okay, thank you so much.
Okay.
Thank you, Debbie, and thank you, Lucy, for asking the question. I'm going to go to General Manager Coombe. I don't know your name, but you are the General Manager at Coombe. I'll wait for you to unmute.
Right, let's close the picture taking and open the vocals. I just want to say, can you hear me?
Yes, go ahead.
Okay, fine. So fantastic. I mean, just Dr. Fernandes, hugely appreciative, really hitting all the key elements there and the concerns that we as general managers, have to deal with all the time. However, is there any way that because these are the points, these are the, the nuts and bolts of what staff are constantly telling us. Is there any way that we can have an FAQ of those very poignant topics circulated? Because I, for instance, have a staff meeting tomorrow, and at the moment I've got 35 staff that's absolutely against the vaccine for all the reasons and more than what Dr. Fernandes has mentioned this morning. And then the other thing is also, would we be able to circulate the link for the people like hairdressers who's coming into the home or contractors who's regularly coming into home so they can have the vaccine as well, please?
I don't think it's hairdressers. I think it's relevant staff, who need to do care, such as podiatrists, care that needs to be done. Or
so I've got chiropodists and physios.
Yeah.
Okay. Yes.
Yeah. I mean, I've had my hair cut once since February last year. And you can probably tell I could make a scarf out of my hair. I don't think hair is important. Clearly, we need to be maintaining services such as podiatry and those essential services. But I think that at the moment, hairdressing should be right down the list.
I kind of think of them all in the same line, and I probably shouldn't. But for me, it's like people like audiologists, opticians, dentists, and physios.
Yeah.
And I send out the FAQs every week, and the same will happen again this week, and will be sent out on Friday.
Lovely.
So,
thanks, Jiggy.
Yeah.
So, sorry to interrupt. So Sonia, this is Brian Roberts from Kingston, Richmond. So you should have received the FAQs from me on Friday. So that will have the link and the Excel template on it. If you have trouble finding it,
fantastic, Brian. I will look for that. Lovely. Thank you.
Great. Cheers, Sonia.
Thank you. I'm going to take 2 more questions, and then I'll have to close because we've run over by half an hour now. So, Tina, please excuse me of sounding out your last name. Osiholo. Tina, if you'd like to ask your question, I'll wait for you to come off mute. If you're having difficulty, you can press Control, Shift, and M. Okay, so you can try and unmute yourself, and I'm going to go on to the last person. And if you do manage to unmute yourself, you can ask your question after Hazel Joseph.
Hi, Jiggy. It's just clarification around my earlier question around the LFD registration. If there's anyone able to answer that.
Sorry, I missed the question. Could you repeat
It's the questions around. So we need to register the LFD for staff who tested negative. So is that compulsory? So we completing the LFD twice a week, and the criteria now is to register it, to complete the registration with the barcode. Is that something that we compulsory? It needs to be done for staff who tested negative.
I don't know the answer to that. I'm sorry, but we can find that out and put that in the FAQs.
Krista, are you able to join in? Krista Caton.
Hi, good afternoon. Good afternoon. It is afternoon. Yeah. There is a link. I was just going to share the link actually. Yes, and that is correct. You do need to. Care homes do need to start making sure they register the results from the 15th. At the moment, we've got a grace period. I believe care homes have got a grace period up to now. Some people are already doing it anyway, but from the 15th of Jan, they need to make sure they are all doing that. And it is in the link. I think it's in the link that was sent out last week, and we can send it out again. But yes, to answer the question, you need to register the results. And if you've got any problems with registering the results, then you can contact 119, the specialist team. One of the things that the team has noted is that some people are misreading the barcode, and so that it's coming up invalid. The first three digits on the barcode are numbers, and letters, and the rest are numbers. So if you misread it and you think an I is a 1, then it will come up invalid. So you do need to register, and you do need to make sure that the detail is correct and not saying invalid. And everyone should be doing it from the 15th.
Thank you.
If they're not already doing it.
Yeah, thank you so much.
Can I just also say that if you want to get more information and you're not sure, then 119 is the number to call in regards to the lateral flow device. If you're right, most people should have had it by now. If you're from Merton and you haven't had it, please contact me and let me know. And if you have not had it at all, then 119 is the number to call to let them know that you've run out, and they will send a supply. All right.
One last question. There were information shared that they will be sending out scanners to the care homes to scan the barcode. Do you know if that's been done?
You should have actually received that with from what I understand is some care homes actually received the barcode separately from the actual LFD other resources. So you should have barcodes and all the other items. Again, if you haven't received your barcodes, 119, and then they would you will need your care home registration number so they can track it.
Okay.
Thank you.
And if you've got a problem for Merton, then let me know, please. Thank you.
All right. Thank you. Thanks.
Thank you. I'll just ask Tina's question. She had put it in the chat. How are you able to get the vaccine if you are planning on becoming pregnant right now, if you are currently trying to get pregnant?
Yeah, so as I said earlier, the guidance is changing all the time, and as more evidence is building up that the vaccine seems to be safe in pregnancy, pre-pregnancy, and in postnatal period and breastfeeding as well. So at this moment in time, the latest guidance suggests there's no risks.
Thank you. I'm going to have to end there.
Can I just leave you with one comment? Because
yes,
of course. Perspective, is the rationale for vaccination, I think we discussed in detail, but the figures are quite stark. So in the first wave, care homes felt they were left behind, but actually, and rightly so. But in where we stand at the moment, care homes and care home staff and care home residents are right at the top of the agenda for the whole of the pandemic. And in terms of vaccinating, as I said, 20 care home residents, you save one life. If you vaccinate 600 over 80s, you save one life. So this is about saving lives as much as anything else. So there is something also about care home staff recognizing if that's the case with their residents, then how does that apply to them? And if it keeps their residents alive and prevents them from getting the disease, then shouldn't that apply to them as well? And so I think the opportunity there for care homes to be front and centre of the health and care strategy in this country for the first time compared to earlier on in the pandemic. And I think you need to seize the opportunity to keep your residents safe and to keep yourselves safe with the vaccinations.
Thank you, Agnelo, for sharing that, and really wise words at the end as well. Thank you. So we'd love to have you back in the future because I think everybody's really enjoyed hearing your presentation and what you've shared with everybody. And thank you, Eric, for joining us today, and for everybody for inviting your staff to join and ask questions as well. But it's been a fantastic session. So look forward to seeing you next week, everybody, for next week's information sharing webinar, where we'll be talking about LFDs, and thank you for all your ongoing hard work, and I know it's very tough out there, so we really appreciate everything that you're doing, and keep strong. Thank you.